Designing a project, most likely the first decision is going to be, is it qualitative or quantitative? As I mentioned before, qualitative will give you the narrative, the colour, the story, and quantitative will allow you to measure things, understand, for example, what proportion of people might be interested in a new product, relative interest in one thing versus another. And then it'll be a question of saying who should be taking part in the research, who are the key respondent groups. If, for example, you're talking about some implantable device therapy, it may be a referring physician who refers the patient, an implanting physician who actually implants it. There could be other clinical stakeholders. We often talk to nurses, biomedical engineers, all sorts of stakeholders, and then even payers as well, increasingly of interest. So you've got the approach, you've got the sample size. What are the objectives of the study? What do we really need to know? Both the big picture objectives and the more tactical, smaller questions that need to be answered along the way. And last but not least, who are the stakeholders on the client side? We often at the start of the project will think about who's going to be in the room when we present results and work backwards from there. What are their key motivations? What are they interested in? What's the best way to present to them? And generally, how can we make sure that they're receptive to the research? Ideally, by getting them to buy into the research at an early stage.